Zone 3 podcast. This is Robert. Reggie's the dude that's invading my personal space to my left. What's up, Reggie?
I'm not going to make it without I'm sorry.
It's okay. It's okay. Today we've got Chad across the table from me, and Chad is a registered nurse who's got 12 plus years experience. And today we're talking about the subject of infection control, isolation precautions. Basically talking about make sure, tips to stay safe and avoid getting COVID-19. So,
Yes.
Chad, if you would introduce yourself. Where are you from? Tell us about yourself.
Again, my name's Chad. I am a registered nurse. I've been living in the Phoenix area for the past, I guess about 18 years. Grew up in Nebraska, moved out here for the weather because who doesn't like Phoenix
Right.
in April and May, or in March and April, except when the COVID comes and shuts down all your spring training and
Right.
all your concerts and everything like that. But
Golf courses are still open.
golf courses are essential. You're absolutely right. That is dear and true to my heart.
By the way, he's got a shirt on that says he's got a hole-in-one. Have you had a hole-in-one?
I have had a hole-in-one.
Is that how you got the shirt?
My wife did purchase this shirt for me. I do.
So you had to purchase it. It wasn't like a prize?
It was not. I got a little coin, a little casino chip,
I would carry that around.
and
Or
I
a shirt that
framed
says
it.
I got a hole.
I definitely framed it. It was
That's
it was
awesome.
pretty cool. So yeah, I'm here to talk about the COVID. I mean, who's not talking about it?
Everyone. So we
Yeah.
know each other because we work together, right?
That's true.
You
Very
work in
true.
radiology. We're in about, how many bed hospital do you think?
About 250, 300, somewhere
Right.
in there.
And growing,
You know,
right?
yeah,
Rapidly.
I mean, if in healthcare, if you're not growing, you're dying. So, I mean,
See, we only bring the best on this show. Well said.
Well, obviously, I think there's a need for the content that we're going to provide today, and that's really a lot of questions out there about what is it like working in healthcare right now, specifically hospitals,
Yeah.
which is the experience that we currently have. And also, what can we do to make sure that we're being as safe as we possibly can, in addition to these isolation or these quarantine and social distancing. So
Right.
we're going to talk about proper hand washing technique, and I think Chad's a perfect person for that to explain.
I have washed my hands before, gentlemen. I've done it. There's
And
no
I
doubt about
personally
it.
have seen that. We were in the
Thank
restroom
you.
together earlier. and
Yes.
I
Is that where you
vouch
guys
for
went?
it. Yeah, I
That's like
swear
an
to God,
hour.
I swear.
Well, you're
Please
supposed, you
believe
got to
me.
wash them a long time, Reggie. You got to wash them a
That's
long
what it was.
time.
Solid minute, according to the World Health Organization. We're going to play a video from
Nice.
later on proper hand washing technique, but we're also going to talk about PPEs today and isolation precautions and what's the proper donning and doffing. And if you work in healthcare, you understand these terms. Donning and doffing, which is what's the proper way of taking on and off. Personal protective equipment, which is things like gowns, masks, goggles, gloves, these sort of things. I know that you've mentioned before about you've seen personally witnessed people taking gloves on and off improperly, so we'll cover that.
Yep. Yeah, it happens. It's just they don't know. They think everybody thinks they're trying to do the best. It's probably better than what they were doing before,
Right.
but there are some things that are just horrible, and that you don't want to do.
Right.
So,
Like put a glove in your mouth.
yeah, or back into your pocket,
Right.
because you don't want to litter. I've seen so much littering of gloves. It's really sad. Just dump it in the trash can as you're coming out of the whatever you're coming out of, whether it's how much is open, fries and or grocery stores and
Right.
what else. Shoot them into the trash can, which is always a fun game to take gloves off.
Right.
See how far you can shoot them. I'm just kidding. You don't want to shoot them too far.
I'm serious. These are fun.
Well, I mean, you take them out and you never.
Yeah,
Yeah, that's
pretty
right.
good.
I mean,
We got to get a sound effect for that.
yeah. And that's when then you put your hand sanitizer on, where people are just getting in their cars and then they're shooting them or taking them off outside of the car, and
Right.
that's sort of okay. It's just not good for the environment. I mean, nobody wants to see our trash lots littered with PPE, and that's what
Right.
PPE is gloves, masks. It's personal protective equipment, and most of the time it needs to be worn by healthcare people and not your regular people. The CDC is recommending that we do wear masks in public areas. Right. And so do what they say.
And for the record, we're in a room with just 4 people.
Yep.
Right.
And I'm more than 6 feet away from you, right, Reggie?
Yeah,
So it just
I
adds
mean,
weight.
for sure. For sure.
Is that what it's doing to me?
We-
Camera
Oh my
takes
goodness!
away
Holy
inches.
cow!
You can make whatever joke you want there. All right, cool. So I do kind of want to talk about more about your background.
Yeah.
You said you've been in radiology for, well, you didn't say, but how long have you been in radiology?
Well, I guess my background in nursing, which most everybody's probably a little bit more concerned with than my massage background, but nursing, I started off as a young kid and did a weekend manager position, was thrown to the wolves, served in home.
Hospice care?
No.
Home
Sorry,
visits?
excuse me.
Can we help you?
Old folks home.
Charades?
Yeah.
Oh, like retirement home?
Yeah, it's a retirement home. That's horrible that it
Yeah.
just said old folks home, but it's a skilled nursing facility. That's the real
close.
technical term that I'm looking for because
We'll
I
edit
am a
that out, Chad.
professional.
Yeah.
We'll
Thank
edit
you.
that out.
That hurt.
Yeah, we round
Just for
up
the-
in zone
yeah.
3. So it's not bad.
Yeah. So, anyways, I worked at a skilled nursing facility as the weekend manager for about 9 months before they let me go, and then I started my career over at a acute rehab facility. And that's where I got to know and work with a lot of my patients and get to move them and things of that nature. And then
Right.
I fell in love with transplant patients.
Right.
And that's where a lot of my background comes. I did about 7 years on a transplant unit, fresh kidneys.
That's pretty much like being in the ICU just about, right?
It's a step down. It's step
Okay.
down. It's not ICU. It's step down from ICU. The ICU would get the livers for a couple of days, the post livers for a couple of days, and then I would get them up and, as they say, whip them to move them and things of that nature, and get the patients moving up and educate them and their families to go home. Not that they didn't have education before, but I was there to beat it in again
Right.
and again and again.
Things kind of change a little bit after you have a huge transplant like that too, right? Just like your muscles and like how they cut you and stuff, right?
Oh, it's a big boy
It's a big
surgery,
boy.
Reggie.
I can
It's a
only
big boy
imagine.
surgery.
Woo-wee.
Yeah.
We're
You
at-
don't want to get one if you don't need it.
Right.
That's for sure.
We're in one of the leading hospitals for transplant patients.
Oh, in the nation, for sure, yeah.
Yeah.
So that's something to be proud of, and so that's a good transition for you to come in.
I mean, no one. So then, how does radiology? How do I find my way to radiology? My wife is also a nurse, and she begged and begged me to be a travel nurse. Well, as a travel nurse, I traveled to Seattle for a summer, and then coming back, she'd already taken what in nursing what you call a floor position, and nursing at Mayo. Excuse me, we can edit that out. She had taken a floor position, and I wanted to be with the same facility that she was, and so they only had this outpatient position for me, and I took it, and I fell in love with it, man.
Oh, nice.
It was great. I mean, the people that I work with are fantastic. The work that they want me to do, I'm gung-ho. I love it. Like, sounds good. Sign me up.
Well,
And I think I'm good at it, you know?
well, I have to speak to that because
Yeah.
I don't think I've ever met a patient that you have talked to that didn't love you.
Well,
Like literally, oh, that Chad guy, he was amazing. I hate IVs, but he can do my IV anytime.
There's a reason we
His
invited
pickup
you.
game must be nice on the streets. Then that's what I'm
He's
thinking.
a married man. He's a married man. But if he wasn't,
yes, thank you. I am a married man. You're
You
absolutely
could
right.
imagine.
And starting an IV never got me a date ever. That's for sure. That is for sure.
So that means it ain't gonna work for nobody then.
No, I didn't have much success even with the massage game either. But I am married, so
Nice.
sealed the deal
You
there.
had enough, right?
Yeah, it's.
Well, congratulations.
Yes, thank you.
Okay, so that kind of got you into radiology, and you said you appreciate, your experience
so
you've
we
had so
did
far.
another
and-
stint, left again for the summer because we, at that point in time, me and my wife, we like to reference ourselves as employed snowbirds. We left and did a stint in Cape Cod, traveled all throughout the Cape Cod system as far as what we were deemed as float nurse.
Dang, Cape Cod is awesome.
And then came back and did another stint, and then we also left again for our third summer to Hawaii for an island, and then I came back, and now I've taken on a full-time position where I'm super thrilled.
Wow, you've worked in a lot of really cool places, man.
Yeah, it's been fun. It's been quite an adventure.
That's awesome.
I'm definitely glad where I landed, especially now with the way the hospital is.
Oh,
I
right.
mean, wow,
It's
isn't
tough
that
times.
something, gentlemen?
Yeah, it's tough times.
Right, and we're actually going to cover that. Like, what is it like working in a hospital right now? Because we are getting that question a lot. I'm getting it from friends. I'm getting it from family. I actually
yeah.
made a post on Facebook about it. So yeah, but before we go into that, we kind of want to talk about what is it that brought us here today. What brought us here today is, the COVID-19 was on the subject of
Yeah.
everybody's mind. I know you're hearing about it everywhere,
Yeah.
but if you're curious about our perspective, we do work at a hospital. If this is your first time watching this, Reggie and I work in radiology. We're both MRI techs, and we work with Chad, who's a radiology nurse, but he's got experience beyond that. But let's talk about first, what is coronavirus and COVID-19? Mostly you hear both of those things, but what's the difference?
Right. I think the coronavirus and COVID-19, the best way I've heard it explained is, if you will, if you look at dogs, like the coronavirus is a dog.
All right.
Well, there's a whole bunch of dogs. You
Right.
can have a mutt here or what there. I mean, everybody's had that ever wonderful, oh, I got the summer flu, or I got that thing that's going around.
Right.
Well, we obviously know COVID's going around, but it's a very specific marker that is that way.
So it's a specific breed of dog in your analogy.
Absolutely.
Nice.
To keep
Okay.
on
Oh,
with
that's
that.
awesome.
Yeah, you're absolutely right.
So coronavirus is kind of more like the
Shih Tzu?
Yes, it's definitely the Shih Tzu of the flu. You're absolutely right.
Come again?
Well spoken. Well spoken.
So coronavirus is a multitude of viruses that encompasses things that go all the way from like colds all the way
Yeah,
to COVID-19.
I mean,
Right.
you could make that analogy as broad or as
So that is a broad
delicate
stroke.
because-
Just say coronavirus. To be more specific, is COVID-19, and that is the difference.
So that's the
Yes.
coronavirus of 2019, right?
Yes, that's
Okay.
how it gets its name.
Is that? I didn't know that.
The
That's
name
interesting.
is from COVID and SARS of some point in time, and that was discovered in 2019, and that's how you get it.
Yeah.
That's why earlier in this testing process, you were seeing that some people were getting 2 nasal swabs to test for both of the SARS and the COVID type situation.
Oh, we're
to
gonna
then
talk about that.
determine-
Can we talk about that? Because I got to get some stuff off my chest.
Let's talk
the
about it.
nasal
Actually, this is a great experience.
Oh. Sounds like somebody got one.
Oh, my
Sounds
gosh.
like that.
swab. Oh, man.
Which is the reason I'm more than 6 feet away from Reggie right now. Again,
And-
camera adds.
Let me go ahead and put it out there. I was undetected on my COVID-19 results, but man, not to scare anybody out there about that test. If you haven't had it, just prepare yourself, because what the nurses, like Chad, will tell you is that there's going to be some discomfort. That some is used very loosely, and honestly, it was. I'm very sensitive when it comes to my nose.
And I don't want to put words in your mouth, but it's a Q-tip. How long would you describe it?
I mean,
Don't
I
exaggerate,
got a
Reggie.
pretty big nose, as you can probably see still through my mask, and they literally probably touched the back of my head with that Q-tip. Yeah,
To get a good sample, you need to get into and near the esophagus. So you have to go through the nasal cavity back, and just what that means is you got to touch the back of the throat.
up there.
Typically in
That's it?
nursing, when you are administering this particular test, we always joke with the nursing students and say, number one, lick it first, just to give it a little bit of lubricant,
Right.
and then go until the person coughs, and then go about a centimeter more and give it a twist.
Dang. Ooh,
Is that sound about what you
that was-
got?
but I got a few more twists.
Yeah.
So why did
Like
they have to
good.
go?
Yeah,
Good.
I feel like it's
Because you
twisted
don't
for
want to
like
have to do it again.
30 minutes.
You
That's
don't
how
want
I
to have
felt.
to do it again. Yeah, it probably felt like 30 minutes. It was probably more about like 5 seconds.
Yeah, that's what my girl
And
said.
that was
I don't believe it.
about 3 seconds too long.
Exactly.
But it feels like a lifetime.
It was quite the experience.
Curious, why do they have to go through the nose? Why not through the mouth?
It's easier. You
For
don't, and you
who?
don't have to worry about people biting you.
Oh, that's dang.
So
You know what's funny?
That's a lot of it.
Once they get back there.
Because-
Okay, my bad.
Yeah, no. I'm just saying, like, because if you go down the mouth, then people will naturally have a gag reflex or not a gag reflex. You got to throw up and puke and things of that nature, and that will also compromise the test. So you're going to get a cleaner test by going through the nose. That's the reason. it's not just to torture you, contrary to popular belief.
Right. Well, it's funny because I felt like she knew she was in the right place because I felt like I had to, like it was gonna make me cough. Like right where she was at, it's like tickling me just enough to like make you cough. So I was like,
A lot of people say it
that's
felt like
interesting.
they got their brain tickled.
Yeah,
Yep.
exactly.
Mhm.
Yeah.
Sounds like you got a real good test, Reggie.
Oh,
Nice
yeah.
job.
Thank
I'm
you.
so glad you survived.
Yeah.
And are here to tell the
Me
story.
too. Oh,
Came back negative, so
Yeah, that's even better. That's even better. I mean,
whew. I mean, I felt like I watched The Lion King again, just in tears.
yes.
like Mufasa
yes.
died.
Yes.
Whew, gets me every time.
I mean, there are other tests that use that same Q-tip, typically for STDs, just FYI. So if you can
I
imagine.
can get worse,
I went
huh?
to an ENT once, and he did it because I had a deviated septum, and he did. I don't know the reason for it. But
Dang.
it was a Q-tip about this long.
Yeah, about
Put it in there, my eyes exploded. It was the
6
most
to 8 inches is
discomforting
what they're
feeling
going
in
to
the
come
world.
at you with. Sorry to
Ooh.
talk over you, but 6 to 8 inches are what they're going to come at you with. And then they're going to take it after they, if you will, get their sample or assault you. Some people might say
Yeah.
it's not an assault because you're asking to have it done.
Right.
And then they're going to take it, they're going to put it in what is called the culture. They're going to snap the end of it off, and then they're going to screw a little top onto it and
Send it
slap a
off.
label on it. They will probably check your name several times. If they don't, go ahead and tell them your name several times.
Right.
It's okay. And that date of birth, because we all love it.
Right. Gotta check twice.
That's right.
Well, we're going to talk about what led you to even get tested here in a moment, because I do want to kind of talk about what the experience it is like to work in a hospital right now. So I'll kind of start it off. What I would say that it's a how would I describe it? It's a
Describe.
just the overall mood and
Oh,
feeling working in a
hospital.
hospital right now. So it's like it's more of a
Well, there's bouncers at the door.
yeah. When you walk in, you're going to be greeted by people who are prepared to give you a mask because you're expected to wear one every day,
Right.
all day for your full shift. If you work in direct patient care, this is at least the hospital that we work at, then you're going to switch out that mask once a day.
Right.
If you work in indirect patient care, then you'll be holding on to that mask for a week. At least that's what it was one day, and that policy changes every day. So that's kind of another experience that we have, is that constantly evolving
Updates.
policies.
Policies. Yeah. Guidance.
My emails
guidelines.
are just getting blown up for sure. So it is a lot to kind of keep track of. But overall, the mood is just it seems really somber. I don't know.
Yeah, we're in Arizona out here, and we do have plenty of cases, more than I'm fairly comfortable with. I wish we had zero, but we're definitely not getting hit as hard as like California, New York, Chicago, some of those more urban areas. I mean, because we're a big city, but we're very spread out here. I mean, I think I got at least
Urban
good.
sprawl is social distancing in itself.
Right. That's funny.
It's interesting because New York, you're on top of each other.
Yeah.
There's something to that.
Yeah,
You're-
that's
you're-
what's hopefully going to help us out is our urban sprawl.
Right.
Unfortunately, what they're saying now, or at least the reports that I'm reading, is it's just going to extend it a lot longer, which is everybody's concern. When does this thing get over? And
Right.
what do we do when we come back? And blah, blah, blah. But
How's this going to change things?
I
Right?
agree, gentlemen. It's a very sombering
It's
sort of.
somber. People are stressed out too, and they're stressed because they're concerned for their own health. They're concerned for the health of their patients. They're
Yeah.
also concerned about job security because there's people that are doing mass layoffs.
Right.
In the world of healthcare as well, because there's things that are considered
Routine,
routine, and there's,
Right.
and there's things that are considered urgent.
urgent, or emergent. And those are agreed, three very different levels, and those levels are changing because facilities were already stressed already to get people in. I mean, it wasn't like you
yeah.
could just call and go, "Hey, I want to go see my doctor." Well, now you kind of can, which is great to a certain extent because we're doing all these video chats, and I think this is going to be good in that respect.
Right.
But not everybody, for you guys, has an MRI machine in the garage.
Right. Exactly.
Although I would love to have an MRI machine in my garage, but
2030, baby.
I know a guy.
yeah, exactly. 2030, that's right. You got to be able to come in. You got to be
Yeah.
able to get those tests, and that's what is going to help either monitor the progress of this a particular patient's disease process, which
Right.
is concerning. Like it's one thing to put it on hold for a month. It's another thing to put it on hold for, well, we'll call you.
Yeah, pending.
Yeah.
I would say my biggest stress beyond job security. Thankfully, we work at a place where since day one, they sent out emails. And by the way, we are extremely fortunate because we are a minority in the world of healthcare, and specifically MRI techs. And I'm speaking
Right.
for me and Reggie. I don't know about you. But from day one, they sent out emails that said, hey, listen, we're hearing rumors of layoffs. There will be no layoffs. And they reassured us. Now, there is the concern for furloughs and reduce hours, and that's going to hurt your bottom end. But at the end of the day, those things are just temporary. And compared to what the stress that other people are going through right now, losing their jobs, having to pay these bills that don't go away,
Yeah.
we're very fortunate. So
And-
I want to say that.
And honestly, I think a lot of people are super worried about, their family members,
That's what I was going to say. So my biggest stress, and I don't mean to talk over
No,
this,
perfect.
is that. So I have a son who's high risk. He's asthma. And we're not just talking about like every once in a while. He's severe. Takes daily medication for it. And I come home to him every day. And the first thing I do, the first thing I used to do when I came home was give both my boys a hug. And, but now I can't do that. So now I say, little guy, sorry, Daddy's got to run upstairs. I'm going to jump in the
Right.
shower real quick. But as soon as I get out of the shower, I'll come down and give you a hug.
See, now that's funny because as a nurse, I'd been training my daughter to do that for quite some time, even before COVID, because
Well, before COVID, I would just run in the laundry room and change clothes, but I wasn't too worried about showers and stuff. But now I take showers.
okay, all right. My daughter's older now. I don't have to worry about that, but I would change clothes. I guess I would jump in the shower. I don't know.
Right.
I forget how that worked, but clothing change was done. How old's your son?
My son is 8 years old.
Oh, that's right. You said that. Yeah. Mine's a little older. She's 16, so there's not much hugging. She knows everything anyways.
Right.
And I'm a hugger,
We can call her later if there are any questions.
Yeah, we should have brought her in. Yeah.
Yeah, she's very busy. She's very busy.
So that's my biggest fear. Reggie, what's your biggest fear?
Ooh. I think my biggest fear is, I don't know. I don't want to be too dramatic about this, but how this is going to really impact the generations down the line, right? Because I know eventually, and things probably won't ever get the way they were. I always kind of put it like 9/11, how that literally changed how you go through the airport, right? Like I still literally have to take off my shoes every time. So it's things that are good that it's going to change. Like how many restaurants are on DoorDash right now? That's amazing, right? Like I think you can get anything on DoorDash, Uber Eats, Grubhub. Shout out to all those guys.
Yeah, and you know what, by the way, I don't mean to interrupt you, but there's places like Uber Eats and Starbucks, and I just got a free car wash the other day. There's places that are offering free
healthcare.
whatever services to healthcare providers.
I went and
a lot of
got my
times it's just
AC
nurses.
service done today.
Yeah, but they're including all healthcare workers, so that's awesome.
I agree. It used to just be frontline people.
Yeah, first
Right.
responders.
And so I would today on that note get my
Cobblestone car wash,
AC
thank you.
checked out. Cobblestone, thank you. Yes, thank you, Cobblestone. To get my AC checked out, and the guy was like, hey, by the way, we're doing free oil changes for nurses, and he's like, we use gloves on those nurses and things of that nature. Because I kind of commented to him because he mentioned my mask. He goes, by the way, nice mask. I go, well, you guys don't have to worry about it because you got the 6 feet distance. He goes, well, we're doing all these free healthcare stuff. He goes, and because they're healthcare, we are sanitizing their car down before we get into it.
Nice.
And I go, well, I want to let you know, first of all, I don't need an oil change, but I am a healthcare worker. Like, I feel like I have to put that out there in front of people too. And I feel like some of my friends are like, some of that's affecting me too, as far as,
Well, we're high
I
risk.
don't know if you want
Oh,
to
yeah.
go over to Chad's house, even if we sit at a different table, like, it's okay. Chad's
Right.
cool. Like, you can be over there.
You get funny looks wearing your scrubs to the grocery store these days.
Oh, yeah. Without a mask, too.
Without a mask, right?
Without a mask.
Yeah.
But yeah, some of the
Right.
benefits are really great, but sometimes as a healthcare, because we're just really not very busy in our department
Right.
in specific right now, it's hard to want to go skip the line at Costco
Right.
because I have a badge,
Right.
Although then I seen the line at Costco and I was like,
Left my badge in the car.
Where's my badge? I better go get that thing.
Right.
Yeah, thank goodness it's in the car. Let me go get it.
Right.
So a lot of uncertainty, a lot of fear,
A lot of fear.
stress.
For sure.
I mean, we're feeling it too in healthcare, and
I think we just don't know how this is really going to affect us down the road.
but as far as not as far as removing ourselves from that danger, that's what we kind of signed up for.
Right.
So it is what it is.
Yeah, it's funny that you say, when you say signed up for it. I signed up to take care of people, and hopefully that I had the proper equipment to take care of people to a
Right.
certain extent.
That's
Now, I
true.
have done some mission trips. I did a mission trip to Haiti where I knew going into the situation that
That's
I
awesome.
might not have the equipment and I might have to improvise.
Right.
I never ever thought that I would have to do that here in the United States.
Right.
One of the things
Right.
that I came back from Haiti, it was funny, came back and at this particular area that I was at, they ran out of temperature probe covers for the day. And this was several years back, and I'm like, you guys, I promise you, we're going to make it over a temperature probe cover. But people were losing their mind. I wish that was the only problem we were having today, was a temperature probe cover issue. It's very difficult to sit there
Yes.
and say that we signed up for it. It's kind of, there's times where it feels like we're going to war and they're like, here's your bullet.
Yeah.
Do I get a gun to fire that?
Right.
Do I get a gun no, I don't even get a gun to fire that. Okay, I just get the bullet.
But tomorrow
Okay.
you'll get another bullet.
Right.
Yeah, exactly.
And don't lose this war, by the way.
Yeah.
And if you lose this, we'll come over to us and we'll check you in.
I've had more people call me up and just, hey, thank you for being a nurse. And I'm like, it's not even
Right.
Nurses Week. you
I've gotten some
guys.
random texts from people, and I appreciate it for sure.
Yeah, I mean, I'm
Yeah.
not mad, but it's like, why would you hear, man?
Yeah,
Why
I
would you
know,
hear?
right?
Holy cow.
Right.
Yeah. Okay, so that is. I think that kind of sums up at least my experience and yours too. So,
For sure, mine
Sure.
too.
what would you say? As far as your employer goes, our employer, what precautions are they taking?
Now, like I said, the big bullies in the front door, which is appropriate, and they're not bullies; they're very nice people.
Yeah.
But the
Amazing.
temperature checkers, the screeners, as far as that goes, and then they screen again, and they screen again, and then they get to see me, and then I'm screening them one more time. And they're
Right.
like, "Are you serious?"
Right. Well, there's so many times people
Very
get past
much
the front line.
And I've
yep,
seen it.
they
I've
gotta
seen
hear
it
the
because they
question, right,
want
yep.
to see their doctor.
Yeah, exactly.
They're scared. They want to see their doctor. No,
Right.
I'm fine. I'm fine.
Okay.
That's not a cough. It's
Right.
It's okay. I gotta go to the bathroom.
Yeah.
And then they
You know
can
what?
finally let it out to a certain extent.
I've
But
got a
I
tickle
want
my-
to see my doctor.
Right.
You have a tickle in your throat. You're afraid to cough nowadays.
Oh, for sure.
No, for sure. And that's for sure in their defense. Like, I literally drunk a little bit of water, went down the wrong pipe a little bit, and I was in tears trying not to cough in public.
That's appropriate.
Yeah.
You should not cough
Oh.
ever again.
Yeah.
That is.
It was very hard, but I
Yes.
pulled it off.
The next generations will
That's
not
'cause you're
cough.
professional.
They gonna learn today.
So,
All right, so I don't, and again, I don't want to speak for you, Chad, but we do work at the same place, same department. One thing that our boss is doing is they're requiring us to take our temperatures twice a day.
that's right.
Once 1 hour before the first of our shift, and then another one again later.
Yeah, once you get
we're
home
required to wear a
after.
mask. If you show any symptoms, you're expected to stay home.
Yeah.
Right.
Reggie, that's where you kind of come in. And
Yeah.
That's the reason why you took the test.
Exactly. So I'll always kind of run a little hot. I'm run basically about 99, and of course, I guess everybody runs a little hotter when they wake up in the morning. But last week, I was running just a little over 100, like 103, or sorry, 100.3 technically. So,
And what's the cutoff?
so the cutoff is 100.5. I mean,
4.
yeah, 100.4, one of those, yeah. So I was just like right there at the doorstep. So, I did what I had to do is call occupational health, and they put an order in for me to go through this lovely drive-through, which was the best part of my experience because I feel like I didn't have to wait. And that's what I was really, because I didn't feel sick at all. So I'm like, I got to go to the hospital, wait around all these people who were probably really sick.
Right.
And, you
No,
know,
you're definitely going to get
I'm
it.
going to definitely get it, you know, by the time I get the test and an hour after waiting. But no, there was no wait at all. I drove right through, and the way they had the tents and everything built, it was so easy and it was amazing until the Q-tip came out. Godzilla, I like to call it. But
Yeah, that's 6 to 8 inches.
yeah.
Um, so in the hospital, they kind of break down they categorize patients under isolation precautions. There's universal precautions where you would just use the same precautions, and that's typically gloves for all patients.
Right.
But then there's special precautions that you have to show for each one. So there's contact. Actually, I shouldn't be saying this. Chad, if you don't mind, you should be saying this.
Yeah, that's fine. No,
what are the isolation precautions?
You're right on track. Number one is universal precautions. It came out in the 80s. We
nice.
started seeing HIV, to where we just had to treat everybody like they had HIV.
Oh.
And now HIV is HIV still.
Right.
It's out there. It's a manageable treatment. It's not a death sentence like it used to be. And it, if we all remember, was a virus at one time that was very similar, and we had lots of foundations.
Scary
It was
moment.
very scary.
Now with that one's just is contact, right?
That is universal contact precautions.
Okay.
There are rumors out there that if you drink about 3 to 5 gallons of saliva from an HIV patient, you possibly may be able to catch it. I don't want to know you if you drink a gallon of anybody's saliva.
Yeah, how did they test that?
Yeah, I don't know. But anyways,
I'm not
yeah,
volunteering.
so it's a universal precaution. So that's how we treat everybody. Then what we can have is what is commonly referred to in the nursing facility is contact precautions.
Nice.
This is where if you touch somebody, you can get it. We'll see this in wound beds with MRSA and VRE and diarrhea and the ever wonderful and extremely popular C. diff. That is horrible.
Right.
It's a very nasty disease, and that is one disease that you can't get rid of with using hand sanitizer. So people are always asking, well, do I use hand sanitizer or do I use soap and water? What's the best? If in doubt and you have the option, wash your hands.
Just wash
soap
them.
and water. It's the trademark, and it's always going to go that route.
Right.
You can't beat friction and heat.
And there's a sweet spot for that time limit for the hand washing, right?
Yeah, I mean, usually
like a minute or something?
it's 30 seconds.
30
is
seconds.
really what needs to happen. Common theme that everybody sings is the happy birthday song.
Oh yeah, that's
So
right.
if you sing the happy birthday song and you're washing your hands,
Right.
you go that route. And I think we're going to have a little segment on hand.
Yeah, actually,
which is great.
there's a great video on that. I don't think it was the birthday song he sung, but
Everybody's got their own little song.
Right.
There can be fun. There can be some fun songs. You bet. So you got your contact isolations to where you don't want to touch them, and this is, and then you have your droplets. This is where people are pulling this, and this is where it gets a little confusing with some of the COVID issues. Is it droplet or is it airborne? Is it a modified droplet? Is it what is this?
Right.
Like all of a sudden we're getting new definitions of
subcategories and umbrellas. Yeah.
Exactly, which is goofy because things don't typically change that quickly unless we've hit unless.
Right.
So droplet precautions, that's for like your pneumonia, your flus, your whooping coughs, and your bacterial meningitis. And that's where you're going to wear a mask. And you're going to see those like yellow gowns and things of that nature, just so it doesn't, you got to worry about droplets. So spittles. And everybody knows that person that spittles and stuff like that.
Yep.
He's horrible.
Yeah.
And he's spraying it all over the place. You're doing it too. You just don't notice it, and you don't have the list that's cool for radio to go with it. The next one is airborne precaution, and this is for like tuberculosis, measles, and chickenpox. Now, what we like chickenpox, I mean, I don't know if you guys are old enough. I'm old enough to where they were just kind of getting out. I'd heard about chickenpox parties. I never went to one as a kid, but I knew older kids that went to them, and
to catch the chickenpox.
Catch the chickenpox, so you get natural immunity. go that route. Now I got chickenpox myself.
Old
and
school
so-
vaccination. Huh?
Yeah, right. Natural.
That's so that's
I
funny.
hope for everybody that we can get that with this,
Right.
but I don't know that to be true, and nobody does. So it's not like anybody's encouraging, oh, we'll just go out and get it, you know.
No Rona
because-
parties out there.
Yeah, nobody's doing a Rona party.
Yes. And please don't. Huge
yeah.
disclaimer.
Yeah, huge disclaimer. And so that's where you're going to need your N95s and your masks for that. And that's for your healthcare workers. Now, I would like to say a little disclaimer. There are guys that are out there who are in construction and primarily drywallers who can't find their masks. We got to get them masks too.
Yeah.
Because they're just junking their lungs up with all the drywall dust sanding because they can't get their regular mask that they're used to because everybody and their dog is buying it to go to the grocery store.
Exactly.
And so that's unfortunate too.
Gloves,
and then
too.
some people are going, well, what's the necessity of that drywaller out and doing that? And I'm like, well, if he's the only guy in the room, like, it seems decent.
Like,
you know?
I guess some people are confused about an N95 versus like a regular mask that people are like kind of selling online and stuff, right? So, I mean,
Maybe
like,
talk about the difference. Like, we should have covered that maybe.
Yeah, I mean, like
Yeah.
you guys are wearing what is commonly referred to as a surgical mask. I'm wearing a homemade mask that my mom was nice enough to make me. The protection level for your surgical masks are probably a little higher than mine. You can see that they're a little bit tighter around the face. Mine's got a little bit of open gap here. At our facility, they were saying, you know, with the surgical mask, then you could wear your homemade mask over top of it.
oh, nice.
To keep the soiling
seen
down.
people doing
Well,
that,
when it
yeah.
comes to girls, you guys aren't girls, but girls wear makeup and they get makeup on the inside of their mask. And Robert wears makeup. Yeah, well, whatever, it's
I
fine.
swear to God, look.
Yeah, right. Yeah, it's just foundation.
It's just touches here and there.
And so, like, to then make them wear it again, like, it's weird. And like, I came home the other day and I had zits underneath my nose and on top of my nose. Like, tip of my nose was sore as heck.
Yeah.
And I'm like,
Back of your ears.
yeah, and my mom's got these little button ribbons that she can sew too to help take some pressure
A
off.
lot of
that.
people are doing that. Thank you to all those people doing
Yeah.
that.
Yo, you know,
Makes it, like, we appreciate that.
you bring up a really valid point. One thing that I think people are not going to notice until it's too late are super weird tan lines.
Oh, already seen one at the grocery store today.
Oh,
This guy had the worst like golf glove tan in the world because I always see him pushing carts. But now he pushes them with gloves.
Oh, wow.
And his hands are just white as white can be, and he is.
It's like he never
dark
took the
as
gloves off,
night.
huh?
Yeah, I was like, I'd give him a hard time,
Right?
and said, "Wow, man, you washed your hands so much, you washed the black right off."
He's not joking around.
Yeah, and he was like, and then he had to explain to me what he was doing, and I'm like, I got it,
Right.
I gotcha. But I mean, yeah, it's some very strange tan lines, and we've seen those in Seoul, Korea, also with the SARS outbreaks and things of that nature.
Let me, just because I saw this really interesting video on how people can test their mask to see if it works. I honestly don't know how legit this is, but it seemed pretty clever. And I'm sure with the need for a mask, there's going to be plenty of, I don't know, I guess people trying to sell some bootleg ones or reused ones. So this is real quick, just a quick 50-second video.
It's on mute.
I don't think they say anything anyway. I don't need any volume.
Is that a Schneider sheet?
This is very, very interesting. This is like burning a flag right now, so please don't do that. But maybe this might, I don't know. Yeah, the blow test is very interesting.
I wonder how that would look with a lot of these homemade ones.
Oh,
Yeah,
we're right
interesting.
now.
Very, very
Yeah, so
true. Yeah.
this
All right, we got a lighter right here. Let's give it a try, Chad.
All right, I'm in. Okay.
don't do it, Chad. You don't have to do that.
Don't do it. No fires in that. I love it.
I want to try it here. Throw me that lighter, dude. I better catch that. I'm on camera. Are we ready? Are you showing me or are you showing, like, what are we doing here? Are we ready? That was easy.
Yeah.
Yours went right out?
Wow.
How many times have you worn that one? Have you worn it all day?
Here, let me
That's
see.
a fail.
Curious to see how Mom's does.
He definitely failed.
Go that other.
Well,
A for effort, Mom. Wow, that works.
yeah, I mean, again, it's most of the masks are there to protect everybody else. It's the mask is there to catch your germs.
Right.
And even if it gets 1%, that's more than 0, right?
Well, we know it's getting more than 1%.
I
I mean,
know.
because if you sneeze, it's going to catch a good chunk of it.
Right.
You know, especially the big pieces. You know, and dibs on those later. But that's what a majority of the masks is for, especially with a lot of the patients that I'm dealing with, which is our transplant, our immune compromised patients. And there's so many of them out there. I mean, you got your elderly people who have arthritis and they're taking arthritic medications, which is an immune respiratory suppressant that they take so their joints don't swell on them as much. And so grandma and grandpa are out there, they're taking, well, no, I'm not immune compromised, but I'm taking my arthritis medication.
That's a very good point.
You know,
yeah.
and they don't even realize that, which is, you know, and so now they're hitting 2 or 3 or 4 categories on the tick sheets and stuff like that.
Right.
And that's where we got to try to protect them a little bit more too.
Interesting.
And so that's why I wear my mask, especially in the hospital right now. Like, people have been giving me a hard time saying that, well, man, with the hospital being kind of as quiet as it is because we're not doing any urgent or emergent cases,
Right.
it might be one of the safest places out there. Yeah, sort of. I mean, except we have known COVID people walking around. Well, they're not walking, but and we have a lot of people testing too. And we do have some of the equipment, but I wouldn't say that everybody's 100% geared up at all times. Like, I mean, it wasn't unreasonable to switch out a surgical mask and a PPE gown. If I had a contact patient, I did it 10, 12 times a day with one patient.
Right.
And now I get one.
Right.
For the day.
And you wear it the whole day, and you see by the end of the day, that's what happens.
Yeah,
it fails the blow test.
Yeah, exactly. Yeah, exactly.
But the analogy is interesting because it's pretty much saying it's like being in the eye of the storm is the safest place to be. And it's like, it might be look that way.
I mean, right. At the same time, everybody around you is very aware of what's going on.
Right.
Everybody knows what they're doing. Everybody, I mean, I've definitely cleaned some things. Have you guys cleaned anything at work?
Oh, for
I know
sure.
I've cleaned.
Yeah.
I get Reggie to do that for me.
Yeah, well, yeah.
You missed
I'll call Reggie. Yeah, I'll call Reggie too. You know, so there's some truth to that, but
it's just one of those things,
yeah,
right?
I mean, it is what it is.
You want to stay at home
I feel
right
a
now.
lot more. I feel that the grocery workers are probably putting themselves out there a lot more than because they don't have a health screener at the front door.
Right.
And if you're sick and you still need beans or whatever, and you have nobody else to,
right.
I see the fear in their eyes too, and I'm checking out. I'm like,
oh yeah. Well, I mean, that's where you're holding your cough.
Right.
You know.
Yeah, for sure.
For sure.
So we covered the isolation precautions. Did we contact droplet and airborne?
Yeah, and how COVID is kind of.
And we'll post some of this stuff in the show notes.
And for each isolation precaution, there's a expected standard of what you would wear to keep yourself safe from whatever exposure you're about to.
Yeah, that's true.
So what we're gonna do is we're gonna go over donning and doffing PPEs. There is a proper way and an improper way. Because at the end of the day, these things that you're wearing are contaminated with things that you don't want to be exposed to. So you have to make sure you take it off correctly. Otherwise, you're just
it's got to be
counterproductive somewhat. So
standard precautions, right? No.
We went over standard precautions.
I mean, the donning and doffing.
Donning and doffing
is going to be.
No.
Is it a video?
We didn't pull it up. No, I didn't do it. Actually, I was going to do you feel comfortable going over that, or do you want to pull up a video, Chad?
Yeah, pull up a video and see what they got. I mean, everybody's donning and doffing.
Can we get
There
you?
is a very, very specific way, and I don't want to give improper way.
Right.
I have a way that I do it that I feel comfortable with.
But if you would put your gloves
So
on,
kids don't try this at home, is what he's saying.
Ideally, kids, you don't put yourself in a situation where you need to put this stuff on.
Right.
So, and if you're a
How long is that
professional,
video?
then you should have a very good idea of what to do.
How to do it, right?
And understanding too that these techniques are changing because we've never seen times to where you've had to wear the same gown, but you need to change gloves in between.
Right. All right.
So that's where it also becomes tricky too.
Yeah,
you know?
you're really
So that's where it's at there. But I'll try to do my best
you
and,
really
and show you.
yes, you're
what-
very encouraged to conserve as much as you can right now from your employers for sure. For the record, we did not steal that.
It's-
I want to be very clear.
It is
about that.
pre-owned. It's my grandma's evening gown.
It's your grandma's evening
I
gown?
Yes.
used that today.
So not to change the integrity of it.
Just want to make sure there's any people
Most of
from
the time,
legal
you would go like
watching.
this, and when you were dressing for the floor pre-COVID, you would often pop a thumb. through
Pull up
this.
your mic if you don't mind, man. Sorry.
Yeah, stay close.
So pre-COVID, when you would put the gown on, you would pop a thumb hole in it.
Oh, yeah,
No
yeah,
problem,
yeah.
You know, and then you had a good nice
Help
tight
get
seal.
you. Yeah.
You don't do that anymore because you don't want to encompass the integrity. And then you would tie these, and you would always get it back. And then once in a while, you know, you would always get the top. And sometimes you'd put that on before and throw it over the top. But the big thing is when you're taking off, is it's always
Get that mic if you don't mind.
first thing on, last thing off. I do have gloves. I got some right here. First thing on, last thing off.
Just like a nurse, always comes prepared with gloves and everything else in their
You're right.
pockets.
Were you a Boy Scout, Chad?
No, I was not.
You
So the
switched that
big
other
thing
kid.
is again, first thing on, last thing off. So right before you walk in the room, everything's on. You put your mask on last
Oh, nice.
before
Okay.
you go in. Your T95. You want to make sure that that's last. And then when you come out of the room, that is the last thing off. So
Okay.
you take your gown off. So you pop the top usually, and then you pop the back, and they just come undone, and then you roll it off and away from you, and you go like this and roll it down, and you keep it up. I don't want to mess up the integrity of this.
Okay.
Let's say I get that all off.
Yeah. Because you don't want to cross contaminate, right? That's the key here.
Right.
Nice.
And then where's your gown?
That's
So
all
we got
off?
that off.
Yeah.
That'll all be rolled up into itself and then into the gloves. But you can't see what I'm doing in the gloves if it's underneath the gown.
This is your camera
Right.
here, Chad, so if you
And so with the gloves, I mean, what a lot of people will do, the mistake is they'll come in with their finger and they'll touch their skin to get it up
Oh.
underneath.
Contact.
That's right. Boom. You got a problem right there.
Right.
So just grab them and pinch them,
Oh, roll it back, kind of.
and then pull out like this. Take that one, go like that. Now this is where you get inside here. So you get up underneath there. Just grab that. And then you get it like this, and now you can do the shot.
Hey.
Right? Boom.
That
right there. Not a bad
did
shot.
not go
I've
in.
done it before.
I'm just gonna tell everybody right now he missed.
the camera didn't catch it.
yeah, it's all right. But that's the big thing is I'll see
Right.
people get on the inside,
Right.
and so now they're contaminated. Or we were talking about this earlier about how people are really littering a lot in the parking lots. So just
Oh yeah.
if you're going into a grocery store, go wear your gloves. It's fine. Come out of the grocery store, take your gloves off, and now
There's
After you get
turtles,
out-
people. There's turtles.
hit your
I got a quick question.
hit your
too.
hand sanitizer. Then you get in your car. Throw your gloves
Okay.
away.
So it's not taking off PPE. You don't have to necessarily wash your hands. You can use hand sanitizer.
So here's where it becomes even more complicated. They're even saying use hand sanitizer before you even go to remove your mask because we have to remove our mask. So they're trying to keep the integrity of our masks, and so they're have you use hand sanitizer before you remove your mask.
Right.
And then hand sanitizer after you touch your mask, after you put your mask inside your bag to keep it.
It gets complicated, huh?
It gets real tricky real fast.
Yeah.
Basically, what we're telling people just to keep them safe out in the public is if you've been out in public into an area that possibly has infection, that includes Home Depot, and or not specifically that, but just being out.
All right.
Home Depot is always very busy.
Right.
And then go home and throw it in the washer and wash it up. And just go that route, and and when you take it off your head, throw it in your washing machine, and then wash your hands. Very good. Wash them up to your wrist, and you're probably going to be okay.
Nice.
It's going to really help out a lot. If you're immune compromised, you shouldn't really be out much, anyways. But regular folks, just good old fashioned hand washing. It was humorous when our president first came on, and I was laughing as a nurse, going, "Oh my gosh. Our commander-in-chief is literally telling us to wash our hands. This is what the world has come to.
Right.
We're getting instructions from the commander-in-chief to wash our hands."
That's how important it is, right?
Yeah, it is.
Life or death situation.
It is. Yeah, it is.
Nice.
Okay.
I have one more question for you, Jack. So I know there's songs for when you're taking your gloves off, but is there a song for taking your gown off? Like you put your right arm in or something?
Not that I'm aware of, although I can see that's a great show for next time. That could be a lot of fun.
Yeah.
For that. But yeah, for hand washing, there is songs.
Because it's just the duration that they're worried about.
Absolutely. That gets you through the 30 seconds.
Right.
Happy Birthday is always a favorite of mine.
Cool. I've got one that I want to play later, but I would like to play this video, the donning and doffing.
Yeah.
If you guys don't mind, I want to play one that's only like 4 or 5 minutes long if you can find that.
Yeah, we can speed through it too. Maybe do times 4 or something on the video. Shout out to oh yeah.
And then you can just go maybe full screen on that. Maybe.
Yeah, hit that too.
Yeah, that was them putting on the gown and then the T95 mask there.
And I love how people are putting out so much information about this stuff on YouTube and just free resources. I feel like there's paywalls everywhere for some stuff, and I just love how people have a platform to help spread good information like this. So.
Yeah, so there she's actually even cleaning her hands before touching any of the material, which...
Oh, yeah. That's cross-contaminate right there easily, right?
Absolutely.
Yeah.
Absolutely. And then... So she put her gown on, and now she's going to put her mask on. And that's not... The T95s also need to be fitted for the person.
Right.
Like, they have to go through a fitting, so you can't just grab one off the shelf. I mean... It
just
will sort of work, but it's not meant to.
Doesn't have a seal like you need it to. Yeah,
exactly.
Especially guys with beards and stuff too.
If you think you're having troubles breathing through a surgical mask or even a homemade mask, you put an N95 on, and you, especially if you have to do any sort of educating for maybe 10 minutes of a speech.
Yeah.
Like you work it.
You get out of breath real quick, right?
And so here is her outside shield, so she can kind of keep that mask for a little bit longer, and hopefully, and notice the seal up there for the pressure ulcers. That's what we're seeing in a lot of our healthcare. Gloves are extending past her gown, and now she's ready.
So covering your hair, at least at this time, wasn't necessary for COVID, or do we have to do hair covers?
Per facilities. I do believe most facilities are requiring you to cover your hair.
Okay.
Just because. And now notice how she grabs there.
Yeah.
See how she grabs that glove, and then she's going to take that, crumple it up in there. She's not going to shoot it. You know she's not. She's good. Yeah.
She kind of did the no way that time, right?
Nope, that was just
That was
fine.
good? Oh, okay.
That was just fine.
We should totally watch movies like this. Finding Dory, I could totally do that. Straight commentary.
And then notice how she's rolling it inside the clean part into itself.
that with my backpack so we can
And
use
now
that same
she's
time today.
sanitizing her hands again
Oh,
before
yeah.
she goes up into her face. So there, you might be hearing some things in the news called your T-zone. Have you guys heard of this?
No.
This is an entrance way for infection. And it's basically your eyes, nose, and mouth.
Oh,
So it
your
makes a T,
T-zone.
right? There's
Oh,
a
yeah, yeah, yeah.
T-zone. And so she's staying away from her T-zone there, and then she's noticed how she tried to do it as best she could, but that's why she also cleaned her hands before taking it off. Now she's going to clean her hands again. So to don and doff the PPE, you really, to do it properly, it's almost 4 times of washing your hands
Wow.
before you get it on and off properly. That takes time.
Yeah. So in emergency situations, people have to be ready already.
So what we're seeing, and we've seen this on some of the specials, or at least a few of the specials that I've seen, is they're just basically, for lack of better terms, throwing healthcare workers into an area and going, "You got them today.
Right.
Go.
Good luck. Get out there, champ.
Yep. And
Yeah.
try not to go to the bathroom too often."
Oh gosh.
Now, how are you guys doing on your water consumption? Because I mean, I don't know about you, but I haven't heard about recommendations for water consumption to go down. But since these masks have come down, my water consumption is down.
Oh,
I'm
for
going
sure.
home and I'm dehydrated.
Yeah.
Like I'm
Yeah.
tired.
Right.
I'm exhausted. I've had to work a lot harder. And I find that I'm chugging water too.
Right.
Like,
Thank you, David.
once I get my mask off, I
Oh,
really
for
gotta
sure.
get that. Yeah,
I
that was a good
definitely
video.
noticed that Robert's skin's not quite as hydrated as it normally is.
Yeah.
So
It doesn't
It's
seem as
flaky there.
vibrant.
yeah, it's just
So the
missing
people
that
can see my
edge.
skin. We just lean back.
Yeah,
real
let
quick.
me
It's a good view.
show them the crust on the side right there.
Well, really, it's a shame because that's probably the biggest loss in all this: people's freedom and the ability for people to see my.
My face.
This is my bread and butter right here. You know what I'm saying?
Yeah.
But we went over Don and Doffing. I think that's important because if I'm being honest, and you know me,
Right.
Reggie, you know me,
He's a very honest guy.
right?
Very honest.
You know, as far as being in healthcare, you're required to take continuing learning modules.
Right.
And blah, blah, blah. You got to stay on top of it, whatever. We're constantly having to take tests on different things, and one of them is PPEs and what's the proper donning and doffings. If I'm being honest, I get that wrong a lot. For some reason, I always forget the order.
Yeah.
And so it's good to be reminded as often as possible. But
And God forbid if it's a click through on where you really don't have to pay attention to it, right? Like
If
so
in
many
doubt,
people skip those.
sanitize
let's
your
not give
hands.
away the inside
Okay.
secrets. Bro.
That's the trick
That's
there,
the trick.
Robert. If in doubt, sanitize your hands.
Sanitize your
You
hands
know?
and stay out of your T zone
And yeah,
for sure.
absolutely.
We're gonna
That just goes for everywhere. And that's
Smart.
a lot of the good thing for the mask too, is it really cuts off the bottom half of your T-zone, which is the majority of the entrance points. You
Mm.
can now scratch your face. You can now, scratch your beard, which, I mean, David over
do
there,
that.
he had to shave. I had to shave. Everybody had
No,
to
you're
shave
good.
because the T95s don't have a secure fit without the beard. OSHA won't sanction you. So that's why
right.
everybody has to shave.
Right.
Let's pull up a new video.
I got a
we went over
picture.
Don and Doffing. I do want to go over a proper hand washing video.
Oh, sure.
And it's the World Health Organization. So,
Before we pull that up, since we were just talking about shaving,
yeah, please.
Dave, can you pull up the picture? There's a shaving picture that kind of shows like the area. Yes, the one with the little faces. So this is just an OSHA/CDC collabo, and we'll put this actually in the show notes as well, so everyone can kind of get a better look at it if you can't see it well. But no full beard, and a goatee is kind of suspect. I think you could pull off a pretty sweet stash, though.
Thank you. That's very kind
Dave,
of
do
you.
you mind? If you don't mind, my friend.
I didn't realize. I didn't
Dave
know
is
what a
our
chevron
producer. He's the
was.
guy behind the camera, and I would love for him to jump in front of the camera real quick. And normally he's under strict orders.
To not be in front of the camera. That's a good call, you guys. That is a good call.
But Dave, who normally has, and by the way, a beard that I'm envious of, is all stash now. Show that stash, bro.
It is pretty sweet. There you go.
Woo!
Wow.
I love the zoomed in view of it too. Heck yeah. So that's my view of Dave every single day. And that's the reason I come into work every day with a smile. A smile that you can't see because it's behind a face mask. But thank you for showing that, Reggie. That's a great visual aid. I'm a big visual aid kind of a guy.
Sure.
Let's talk about a visual aid of hand washing.
Yeah, let's get into some hand washing.
Proper hand washing technique. Pull up YouTube if you would. And then on YouTube, you can just write in proper hand washing technique and look for the World Health Organization, which has some credibility. And I think there's a video that's only about a minute long.
Yeah, and if anybody's just listening, we're going to have links to all this stuff in our show notes. So just go ahead and go to our website or at the bottom of the video on YouTube.
WHO.
You definitely have access to all these. So you don't have to go looking for them yourself.
We're looking for World Health. There it is. Fourth one down, if I'm doing my math right. There you go. All right. And then go unmute that. There's a reason he's not in front of the camera. So they're going to hear the audio.
Okay.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm on the back of the left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand.
The water
Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water.
Can we please show the real video?
Yes. The one that I showed you?
Yes. I think everybody needs to be more realistic about this and see really
because you can sing happy birthday. Yeah, you could. Type in
big shout out to this guy.
Chris D'Elia, I'm number one fan.
Love his podcast.
I promise if you become a guest on our podcast.
Yeah, for sure. Come hang out in Zone 3, man.
No, keep going down. The problem is so I tried finding this earlier. You almost had to go Google and then hit videos.
He's not trending right now? Are you serious?
Well, the thing is, it's like the videos of people talking about it. See, there it is. So it should only be about a minute. Here you go.
See on how long you should wash your hands to keep clean for this coronavirus. So what I do is I sing a full song while I'm washing my hands. This way I know by the time I'm done with the song, my hands are completely clean. So you can pass this along to your friends and family. But this is how it goes. A little bit of water, a little bit of soap, and start singing. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am so strong when I am on your shoulders. You raise me up to be all I can be. You raise me up so I can walk on water. You raise me up to be all I can. So there's a lot of discrepancy on how long you should watch.
I have a man crush on you, by the way.
Yeah, I like the fact that he went a little higher than his hand. I think that's okay.
Well, he's raising up.
I don't know if you need to get as high as the pit, though, but I like his enthusiasm.
Right.
I like it. I give it an A for effort. That's for sure.
Yeah, for sure. Great job.
So just to kind of wrap it up, I think we covered the basics. Did you have any tips to stay healthy and avoid exposure other than what we're hearing? It's social distancing, washing your hands.
I mean, really, the only thing we can really
Common
do
sense.
is just follow the CDC guidelines.
Right.
I mean,
That's where everyone should be mostly getting their news from, right?
Yeah, agreed. And
try to stay up to date and try not to be too overwhelmed,
Right.
and understand that the information that you had 3 days ago is still the best information that you had, even if you did decide to take a news vacation, which we all need to do.
Right. Oh yeah.
Oh, and I did that. I went camping for 5 days, and it's the best thing I could have done. But thank you for that, Chad. Thank you for coming. Thank you, Reggie, for
Yes.
coming. Thank
Thank
you,
you,
Dave.
Chad.
Appreciate it. We're going to pretty much
Thank you,
wrap
thank
up. So this is a show that we do. It's a podcast called Zone 3 Podcast, and it's dedicated to the world of MRI and everything that involves healthcare related to that. So this might be our first episode we drop because it is so topical. So if you enjoy this episode and you like the content, come back and watch us, subscribe, hit that like button. We appreciate you coming and tell all your friends about us. There is one thing that we will wrap up with. It's a question that we try to ask all of our guests, and it's this. So, Chad, what would you say is the most satisfying or fulfilling experience or that you've had in your healthcare career so far?
And please don't make everybody cry.
No, please.
You know, that's such a broad question, and you kind of prepped me for it. It's very loaded. Just watching one of the patients or any of the patients when the light bulb goes off and they get it.
Right.
Especially when, and my background has always been transplant or maybe even the physical therapy when I was working acute rehab. They just got it. Like the light bulb went off, and it was fun to watch the person start to then gain independence and get away from, no, I don't want to look at that injury. I don't want to have to look at that. And it's like, no, you need to. And being right there for them and with that person and going, this is how it's going to be. Like, you need to take responsibility.
Right.
Doesn't have to be today, but you're going to have to do it. And, you know, I might be the jerk smiling at you every day for the next 3 to 5 days to do it. And when that light bulb goes off, that's so much fun
That's
to
awesome.
watch somebody get better.
Yeah.
And then, you know, maybe even seeing them 6 months later
Oh.
and they come back and they're like, I remember you, you know, thank you so much.
They
Even
always remember you.
in my current job, you know, like,
Right.
no, nobody else is going to touch me. Where's that really,
Yeah.
where's that guy?
Where's
He had
Chad?
the thing.
Where's Chad?
And I'll talk, there he is. That's him. I know it is. I know
How
it is.
satisfying is that moment? I get it every once in a while. Me more
Yeah.
so than Reggie, but I mean, I get it. Right? Reggie, I don't want to put words
I mean,
in your mouth.
No. I mean, you do get it at least once a year for sure. I don't think you're on the same level as Chad
Oh, wow.
by far. But
Well, no, that's not true. I mean, it's so nice to be able to say, you know, like, I mean, because people come in for the MRIs and they're worked up. I mean, they're a cat on
Yeah.
a hot tin roof.
Right.
And to know that I can sit there and say, these guys are going to walk you through it. They got tricks, I promise you. They got tricks. They know them. They got the tricks. And, you know, after a while, I would imagine same thing with nursing. Like, you're like, oh yeah, that old trick.
Right.
Man, those old tricks, man. The more you got in your bag, the more you can throw at them.
right.
And then every once in a while, somebody else has got it, and you're like, oh, I like that one.
Yeah,
I'm gonna take that
I'll take
one.
tricks
That's
from you all the
great."
time, by the way. Yeah.
You know, yeah, and so you're just always learning. So it's a fun career.
Oh,
And
for sure.
like I said, anytime I can help somebody, my daughter, when she found out that I took this job, said, so you stab people all day long. I go, well, maybe I'm good enough to save somebody a poke.
All right.
So that's what I try to go home with.
Awesome.
We've never heard anything bad about Chad. There's a reason.
Never. Yeah.
There are so many people that we
You
work
guys keep
with.
talking to those people, okay? Don't talk to anybody else. Just those people, that's fine.
And we work with a lot of credible, competent, awesome nurses.
Yes.
But we invited Chad.
Yes, they invited me instead.
So thank you, Chad, for coming. This is our goodbye. Thank you for watching. Like I said, this might be our first episode. We've got
Yeah.
several. We hope to be around for a while. This is me and Reggie. We're both MRI guys.
Yeah.
And we hope to see you again. Thank you for watching Zone 3 Podcast. Stay healthy, be wise, and keep your distance.
Yeah.
Wash your